What are you kind of most like excited to talk about right now? Like what's happening in your world where you're like, this is what I'm paying attention to. This is what I could riff on about. What's that for you right now?
Yeah, that's something that I've been thinking about and working on a lot about lately. I would say right now, what gets me really excited is creating ways to give marketing more credit for the
Mm,
revenue that the team brings. And the reason for that is because a lot of times, especially in healthcare, and healthcare, as we all know, is a giant, giant industry. Marketing tends to lag about 10 years behind, maybe even more, than where we should be. And so marketing 10, 15 years ago was not necessarily being seen as the people who bring revenue to the company or to the organization, and really more as, and I'm oversimplifying here, but a creative services team and a team that builds pretty things, cool looking things, or just prints cool things or brochures, what have you. And so, what we're doing at Summit Health and CityMD is creating an attribution model and collecting a lot of data and analyzing that data so that we're able to say, hey, marketing contributed this many incremental patients or this many incremental revenue dollars in the last month or the last quarter, and sharing that to the C level and also our business partners to help change the way that marketing is perceived. And so it involves a lot of data, it involves a lot of process, it involves a lot of education, a lot of re education, a lot of behavior change and change management. That kind of stuff is what excites me.
I love that. I love that. That's been that's come up a couple of times in other industries as well, where a marketing leader like yourself is really fighting for this perspective, this change around how stakeholders view marketing of the like as this
Right.
back in the day it was this call center, it's creative, but now folks like you are like, well, actually no, we can attribute revenue, we can show you how we're growing pipeline, how we're expanding the product experience, etc. So it's people like you actually that are kind of, and especially as you said it well, healthcare is in many ways there's parts that are old and stodgy and kind of and
Yeah.
still catching up to a lot of other industries, and you're there saying, hey, we have to put a flag in the ground here and say, look, we're driving revenue. Can you tell us an example of like how you're doing this, an example of how you've been able to do this well at Summit Health City MD?
Yeah. So we have a performance marketing director and an analyst who work very, very well together, who understand what we're trying to accomplish and have done this before at other bigger companies. And what we're doing is basically, if we're not looking for 100% accuracy, because that's a pipe dream. That is the holy grail, right? 100% accurate attribution. But what we're doing is something a lot more accurate than 50%. So I'd say we're about 75 to 80% accurate. And that might be on the high side. Just let's call it around 70% accuracy. And we're doing that based on the channel that people are coming in. So CityMD, we're a walk-in service. You can't book an appointment. And so what we're doing is using anonymized data from cell phones to tag people that who have seen our ad or interacted with our ad or engaged with our website, and seeing that device come into our location for an extended period of time.
Ah.
And what we do is take that data and have it against a control group, people who have seen the treatment but still didn't come in versus those who have seen the treatment and did come in. What's the incremental lift? And so what we're seeing is there are some of our ads are working, some of them are not. Some of our locations are getting affected, some of them are not. And so that's kind of our walk-in business. Our Summit Health side of the business, where you do have to make an appointment, it is a little bit easier, but also still complicated because most of our appointments are done via our call center. You have to phone it in to make an appointment. And so we're using call center and call tracking analytics to make sure that we are able to tie phone numbers to specific treatments of creative to channels, etc. And then saying, hey, this phone number that showed up on this place drove incremental revenue versus a control group that we had, et cetera, et cetera. And so we built all these different types of models that show the incremental lift, and that's how we're doing it.
That's awesome. Do you create your own dashboards to look at that? Are you like kind of custom dashboards all the way? Yeah.
Yeah. We did create our own dashboard. So we pull in data from Google Analytics.
Okay.
We pull in data from Salesforce. We pull in data from our ad agency. We pull in data from our third-party companies that I just told you about, Cubic and CallRail for attribution. We put it all in one place, and our analyst creates a lot of dashboards for us.
Awesome. That's great. I interviewed the CMO of Colorado. Great. That's a great business, man. They're great. Yeah. They're incredible.
Yeah.
Okay. So in terms of the two different sides of the business, you have the walk-in side of the business, you have the appointment side of the business. Are those pretty equal in terms of driving revenue, or is one like a larger part of the business and the other is like the bigger opportunity, or how does that look? What is that like?
They're pretty equal. During COVID, I would say our urgent care business, the CityMD side, obviously blew up a little bit. And had definitely its fair share of challenges, but also opportunities. And it did. We did a lot of volume, but ideal state, which is where we're around right now, is about 50-50.
The website talks about there being over 200 locations, 2,000 providers that cover this kind of multi-specialty urgent care connected, all connected together. So those 200 plus locations, that's both of the, like some of those are appointments, some of those are walk-in.
Yeah, so we have like 160 CityMDs.
Cool.
And we have quite a few dozen of our Summit Health locations. And just continuing to grow.
There's a lot of urgent cares out there, right? So that's an interesting world. There's a lot of, I know just to here in Austin, Texas, I mean, you drive around, there's a lot of different people that are, a lot of dogs in the fight, so to speak. But there's something different about Summit Health CityMD. Like, what is this? What's like the value prop on like each, like for both of these businesses? They're at the highest level, they're like a lot of other businesses that are similar, but there's something different. What's the nuance that makes like this business so interesting in a space that could be a lot of people in it, a lot of different businesses in this?
I think the joining of the two brands in 2019, CityMD and Summit Health, was a really good move, because what we see in healthcare is a shift to more retail-based care. And CityMD, being the largest in the New York region, is well positioned to grow even faster and expand a lot further out, because they've built a machine pretty much that knows how to take care of patients quickly. They know how to do it efficiently. And that's what patients want at the end of the day, right? You're not going to an urgent care just to hang out and, get some work done with some coffee, talk with friends. You're there because you have to be there, or you definitely don't want to be there. And the last thing you want to do is, again, spend a single second more than you need to. And so the CityMD team did a really amazing job of just making sure that patients are always at the center of everything that they do. I really mean it that way, and just make sure that the experience is hassle-free as possible.
Wow.
On the Summit Health side, it's a primary care to OBGYN to cancer or orthopedic surgery. We handle all of that as well. And so the idea was, how cool would it be to connect an urgent care, which is everywhere, to more of a long-term care structure where it's more of a relationship-based care, and combine that into one experience where all of your health records are in one place. And again, it's really about striving to be the yes in healthcare and not necessarily what patients might be used to hearing in healthcare, which is a lot of no's. Why can't my record just show up on this doctor's office?
Wow.
Or why can't I just go to this urgent care and my flu vaccination or COVID test is automatically uploaded? And so we're breaking down a lot of barriers to have a much smoother and better experience at every step, even when you're not inside of our four walls, to make sure that we have as seamless experience as possible. And I think that's what really sets us apart.
Hey everyone, thanks for watching. Please subscribe to this channel for more great marketing interviews with today's top industry leaders. And thank you to our partners at Salesforce. Salesforce brings marketing and engagement together. Head over to salesforce.com/marketing.